Hello, my name's Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday, the 8th of September 2021. I have to say that because I've been doing it for over a year now. The numbers are going up, I'm afraid to say. So today we've got 54 COVID positive patients in the hospital. 50 are in the general beds, 4 patients in critical care, none in Clifton. I think there's another 11 patients who are here because of COVID who are over 14 days and are therefore not considered to be infectious. So we're seeing a steady flow of COVID positive patients into the hospital each day. Many of those patients are poorly with COVID-related illnesses, often respiratory illnesses, exacerbations of flu-like symptoms, if you like, which make other conditions worse. But it is true that some of the patients who are COVID positive but with other conditions, and of course we have to manage those patients carefully and make sure we reduce any risks of spreading the illness to other people. What we're seeing is that probably 2/3 of patients coming in with COVID have been vaccinated, but there's a third who haven't been, and they're often younger and very often more poorly. So the point about vaccination absolutely persists. It looks as if about 72% of the over 16 population in Blackpool have had both doses, and it's into the low 80% for Fylde and for Wyre. So those 80% figures are good. I think the figure for Blackpool isn't high enough, and really urge anyone who hasn't had either first or second doses to please go ahead and get a vaccination, because it is still a dangerous illness and we're still seeing some people very, very poorly with it. There's a particular call out to younger women who are pregnant who haven't been vaccinated. I've made this point before. The evidence around the safety and efficacy of the vaccine for pregnant women is clear. We've seen some very poorly ladies with COVID, and I really urge people to, if you're in that category, to go forward and get vaccinated, please. Community numbers are still rising, so Blackpool 515 per 100,000, and that's up from the 400s last week. And for Fylde and Wyre, we're up into the high 300s per 100,000. Schools are back, so we are seeing those numbers come up, and frankly we see that happening for the time being. So we're learning to live, really, aren't we, with COVID as an endemic condition, but still a dangerous one. Excuse me. 4 deaths in the hospital in the last week within 28 days of a first positive test. So condolences to the families of those loved ones. That takes our total up to 789 deaths since the pandemic began. Testing. Important that really every adult does regular testing if asymptomatic, so you can get tests for free from any pharmacy and test yourself. Good idea to do it regularly, especially if you're interacting with other people going to school or going to work. But if you are symptomatic, so if you have any flu-like symptoms or the classic COVID symptoms of loss of taste and smell, then the key thing is to do a PCR test, not a lateral flow test. And to book a PCR test, you can either ring 119 or go on the NHS UK website, and it's very clear then how to get through to get a definitive PCR test, which of course also tests for the variants such as the Delta variant, so it helps in looking for the epidemiology of the disease. In terms of ongoing vaccination programs, so the guidance around who will get a third jab or a booster jab is still not clear for everybody yet, but there is guidance about patients who are considered to have a reduced immunity, known as immunocompromised patients. And GPs have a list of patients in those categories, and will be getting in touch with people accordingly to arrange the third COVID jab. Again, in terms of flu jabs, we worry this year about having a bad flu season because we really didn't have one last year and we think immunity will have dropped. So please be looking out for an invitation for a flu jab if you're in an at-risk category. And of course you can get a flu jab booked through community pharmacies if you want to get on and arrange that in your own time. I've talked before about our visiting restrictions and how we review those all the time. Linked to this sort of acceptance that we're dealing with an endemic condition now, we've taken a view as a trust to try and ease our visiting restrictions a little more. So that doesn't mean they are completely back to what we might call normal, but later on in this week we are going to ease our visiting restrictions some more. So by all means, have a look on our website to see what they are. Essentially, we will be allowing visiting to patients on our general wards, but we'll be looking to do those with small numbers of visitors and in restricted time slots, please. So the wards will be looking to arrange that. And for our wards where we have active COVID, so in particular at the moment wards 2 and ward 5, where we've got a high number of patients poorly with COVID, we still need to maintain our visiting restrictions as they are. So there's quite a bit of detail in that really it's best checked first of all with our website and then with the individual ward where your friend, relative or loved one is based. Emergency department, yet again I need to say how busy our emergency department has been and continues to be, and really maybe apologise to people who've experienced very, very long waits either in the waiting room or actually passing through our emergency department. The demand on the unit has been extraordinary. In fact, we've never seen anything like it. So we've put out the front of the department a graphics board which shows how many people are in the department, how many people are waiting to be seen and so forth, so that people have an honest understanding of what they may be facing if they're coming into the department. But I need to remind people, don't I, about using other services to assess risk and condition, using NHS 111 either as a telephone service or the NHS 111 website, where the symptom sorter is very good at taking you through concerns about particular conditions, and then thinking about the GP walk-in centres and of course community pharmacies to help in that situation. It feels like we're all in this together and we've got to try and use our resources as well and as safely as we possibly can. So finally, some thoughts from public health consultants around making sure our houses and our spaces are well ventilated. So if you're in groups of people, please think about ventilation. By all means, wear a mask if you're in public spaces, and you get reassurance from that. And the usual issues about being careful around social distancing and regular hand washing still, of course, apply. Thank you very much.